My personal experience is at the European Gaza hospital, where I took care of multiple injured workers that were specifically targeted. They were targeted by sniper rifles, and they were targeted by what will probably be proven to be an illegal weapon that Israel had used in the past, these tungsten fledgets. They weren't dart-shaped devices that the UN had declared illegal historically that Israel had used. These are small little tungsten cylinders, very much like a pencil eraser in shape, but a third of the size, that traveled at extremely high speeds with almost no visible entry wound, almost no visible exit wound, but homogenized tissues between the two wounds. These they were delivered in cluster bombs. It's an illegal weapon to deliver it that way. They were seen all through Gaza, not just by my team. It's not the size of the wound that matters, it's the soft tissue damage from the cavitation on the inside. So the higher the velocity, the worse the wound. And even if it hits an extremity, the amount of soft tissue damage was pervasive. And we took care of nurses with brachial plexus injuries that have almost no entrance or exit wounds, but the entire brachial plexus was destroyed, vascular injuries, multiple nerve injuries. So when it didn't kill the healthcare worker, it maimed them for life. And often more than one extremity was damaged with no visible external wounds. And so those were horrific. Regular standard high velocity gunshot wounds are visibly devastating, requiring amputations almost always for those who live through it. One story comes to mind more than any other in my personal experience. It's a gentleman who's a nurse, an operating room nurse, orthopedic nurse, closing a wound. I believe it was at the Kuwait hospital. I ended up taking care of him as a victim at the European Gaza hospital. And in that scenario, Tamir was closing a wound on another patient. And an IDF soldier bursts into the operating room, orders everybody to leave the patient on the table by themselves, who's still under anesthesia. Tamir is closing the incision. He refuses to abandon the patient, as all of us ethically would do. In response, he was shot in the knee by the IDF soldier's rifle. It blew his proximal tibia bone, the bone below the kneecap, across the room, leaving a gaping orange-sized hole in his tibia bone, the muscles shredded. And they immediately finish working on the other guy. They take Tamir to the operating room in another room and repair his knee. On the morning of the second day, the Israeli IDF comes into his room and takes him prisoner and whisks him away. And they take him to an Israeli prison. He spends 45 days in the prison. They eventually let him go, which is the IDF's acknowledgement that he's not a Hamas fighter, he's not a combatant. But when they let him go after 45 days of starvation, getting a juice box sometimes every day, mostly every other day, after 45 days of being blindfolded and handcuffed, after 45 days of absolutely no medical attention towards his open wound, they drop him naked at the border. As a going away present, an IDF soldier rifle butts him in his right eye, exploding it in his head. And then he crawls for 3 kilometers till he gets to a roadside, dripping his vitreous humor down his cheekbone and a trail of maggots behind him on his wound. I was told that a cup of maggots was taken out of his leg when they first got him. And somebody brings him to the European Gaza hospital, which is only about 3 or 5 kilometers from the Israeli border. So the gentleman was starved. He was beat. He was, handcuffed. He was blindfolded. He got no wound care, and he did no crime. So this was a definitive targeting of a healthcare worker, from which multiple war crimes ensued, including the violation of the Geneva Convention and the Rome Accords that Israel themselves had signed in 1950. This gentleman was finally evacuated to Egypt. He has a Pseudomonas infection. We're trying to get him to come to the United States, where he can, restart his life here, and that's with some difficulty. Right now, he's had his 25th surgery to try to keep his leg saved, and his life is devastated. When we saw him for the first time, he just got out of a coma. A Swiss Red Cross team was taking wonderful care of him, but they were also taking wonderful care of 1,000 other patients, and he could not get the attention that that small medical team could provide. And he had bed sores on the back of his head. His skull was exposed. The back of his ears had pressure sores. I've never seen that in my life. The back of his elbows, his shoulder blades, all had pressure sores. And this argues for the lack of ability to care for the thousands of patients that were in the European Gaza hospital. It wasn't for lack of desire or wonderful, volunteer nurses, because they were all volunteers. Nobody was getting paid. And all the nursing staff came from very far away to work at the European Gaza hospital, because it was in that area, the only major functioning hospital around. We were getting transfers from every hospital for a plethora of reasons, including mostly the lack of supplies or the lack of operational equipment. A CAT scan was down. We're going to ship him to you to get a CAT scan of his abdomen, and you take care of him. Lack of anesthesia equipment, lack of anesthesia sterilization, the electricity's going down, we don't have fuel. These are the routine reasons for getting transfers every hour into the European Gaza hospital. And we still couldn't take good care of hardly anybody, because we suffered from the same restrictions in getting supplies in.